If you're on Social Security and disability benefits, listen up. I have important news updates for you. The first batch of Social Security checks for December 2024 are about to go out. Up to $4,873 in checks are headed out soon. Are you eligible for that maximum benefit? I'm going to tell you soon. Now, a lot of Social Security retirees are upset about the cost of living adjustment for 2025. I am going to tell you how much your Social Security is going to go up starting in January 2025. And then I'm going to tell you 10 big changes that's going to affect everybody on Social Security and disability benefits. Should pay attention to these changes. They're coming up starting in January. And then finally, I want you to stay till the end of this video because I have important news for you. I have 15 financial assistance programs targeted at low-income seniors that a lot of people should be using, but are not because they simply do not know they exist. So I'm going to give you details and how you can take advantage of these programs. If you're new to this channel, hit that subscribe button, hit the like button. We want as many people to see this video as possible, so be sure to share it once you finish watching it. So let's get to the payment schedule. Up to $4,873 in checks are going out. The maximum benefit is not universal. There's strict eligibility requirements that apply, and benefits are vary significantly based on individual circumstances. So understanding the eligibility criteria is crucial to planning for your retirement. So the maximum Social Security benefit of $4,873 requires you to wait until age 70 years old. If you retired early, then you'll be receiving a maximum benefit of $2,710. Again, I said maximum benefit. Now, your own circumstances would determine how much you would get based on how long you've worked, how long you've paid into the system, and when you started getting benefits. But assuming that you contributed the maximum and you worked for the full 35 years to get the maximum benefit, then at age 62, the maximum benefit you can get is $2,710 if you retired in 2024. At age 66 is $3,652. At age 67 is $3,911, and at age 70 is age $4,873. That's the maximum you can get. Everybody has to collect their Social Security by age 70. You have to, and that's the maximum amount you can get. But there are two primary factors that determine how much you're going to get: your age at retirement and your earnings history based on the 35 highest years of work. They average those years, and that is how they determine how much benefit you're going to get. Now, on the other hand, the Social Security full retirement age has been increasing. Next year is going to go to 66 and 10 months. So if you retire at your full retirement age in 2025, that is the age that you'll get all the benefits you have earned and deserve because of your work history and how much you've paid into the system. So now, what does that mean for you in December? How much money are you going to receive, and when are you going to receive it? Well, as you may know, for Social Security and SSDI, your payment dates are based on your birthday. If your birthday is between the 1st and the 10th of the month, you get your check on the 2nd Wednesday. If it's between the 11th and the 20th, you get your check on the 3rd Wednesday. And if it's between the 21st and the 31st, your Social Security or SSDI check comes in on the 4th Wednesday of the month. If you're on SSI, you get your benefits on the 1st of the month, unless the 1st is a holiday or a weekend. And then there's a whole category of people who get their benefits on the 3rd of the month if you live outside the U.S., if you receive both SSI and Social Security, if your state pays for your Medicare premium, and if you file for Social Security before 1997, you get your benefits on the 3rd. So let's look at the actual dates for December. If your birthday is between the 1st and the 10th, your Social Security or SSDI benefit will hit your paycheck or your bank account on December 11th. If your birthday is between the 11th and the 20th, your Social Security check is going to hit your account in December the 18th. That is the 3rd Wednesday of the month. And then the last group, if your birthday is between the 21st and the end of the month, you should have received your benefit on December the 25th. But that is Christmas Day. That's the 4th Wednesday. And so you're going to get your check a day earlier on Tuesday, December the 24th. If you're on SSI, Supplemental Security Income, You will receive your check early in November 29th, which is today actually, Friday, November 29th. So if you're on SSI, you should have received your check today. If you haven't, then listen up and I'll tell you what you should do if your check did not come in. If you live outside the US, if you receive both SSI and Social Security benefits, if your state pays for your Medicare premium and you file for Social Security before 1997, you should have received your benefit you will receive your benefit on Tuesday, December the 3rd, which is next week. Now, for those of you who are on SSI, you're going to get a check in December, late December, December 31st, Tuesday, because January the 1st is a Wednesday and is a holiday. And so, based on the rules, you're going to get your check a day earlier on Tuesday, December 31st. Now, understand, if you're getting your check early, your SSI payment early, you're not going to get anything in the beginning of January. So this is not an extra payment. It's just your December payment or your January payment actually coming in early. Now, if you don't get your Social Security benefits, there are three things you can do. You can call the Social Security Administration at 1-800-772-1213, or you can go to a nearest Social Security office to find out what's going on with your benefits. Or if you have a My Social Security account online, you can go online and see what's up with your benefits. You can just log in and see if there's any issue with overpayment or cancellation of your benefits that may be holding your benefits. But here's the thing. Before you call or go online or visit a Social Security office, make sure you wait 3 additional business days, because it may just be an issue with your bank that is holding your Social Security benefits. So wait 3 business days before you take any action. Now, let's talk about 2025 COLA. I have said that a lot of people are not happy about that. Why? Because it is going to be 2.5%. Your cost of living adjustments for 2025 for your Social Security and disability benefits are going to be a little bit on the low side. 2.5%. Why? Well, the government is saying that inflation has been trending downward. And since your Social Security cost of living adjustment is adjusted for inflation, if inflation is down, the last read was 2.4%, it makes sense that your Social Security benefits increase will also be along those lines. But here's the thing. You've been used to some very high Social Security COLA because of COVID and inflation. 5.9% in 2022, 8.7% in 2023. And then it started coming down. So in 2024, it went to 3.2%, and 2025 is going to be 2.3%. But here's the thing. I got a chart to show you COLA since the government started recording in 1975. There's been pockets of time when COLA has been high, but it's usually pretty low and pretty steady. There's been some years when it's actually been zero. 2010, 2009, 2015, it was zero. 2016, it was 0.3%. And then there's been certain seasons or certain years where it's been up around 4% and stayed there. But overall, it's a pretty tiny increase every year. So I gave you this chart to show you that what happened in COVID with the high inflation is an abnormality, because your cost of living adjustments are usually pretty low. Now, the reason why your cost of living adjustment has not caught up with inflation is because of the way your COLA is calculated. The government uses something called the Consumer Price Index for urban wage earners and clerical workers. And what they do is that they track everyday items like food, housing, Medicare, transportation, and energy costs in urban areas during the third quarter of each year, and then they compare it to the third quarter of the previous year. And if there's been an increase, then they bump up your Social Security payments. If there's a decrease, then everything stays the same. And so, but some people are complaining that that index is not fair because it doesn't measure the everyday things that seniors are confronted with, everyday costs like prescription drugs, healthcare, that affect seniors in a disproportionate way. So some lawmakers in Congress have proposed a new COLA calculation formula, which is called CPIE. It stands for Consumer Price Index for the Elderly, which will measure price changes specifically based on spending patterns of Americans 62 years and over. Well, according to CNBC, with 13 years until Social Security funds are projected to run out, Democrats have proposed ways to strengthen Social Security, and one of them is called the 2023 Fair COLA for Seniors Act, and then the Social Security Expansion Act. Both of them are supposed to include this CPIE idea in addition to trying to fix Social Security, which is running out of money. And if nothing happens till 2032, retirees, new retirees, and perhaps current retirees may not get their full benefits. So let's look at what this Social Security Expansion Act is trying to do. The first thing is that it's going to give you an immediate $200 increase in your Social Security benefit for all recipients. It's going to have a new COLA, cost of living adjustment formula, to better match the real world expenses, especially healthcare costs. Increase minimum benefits for elderly and disabled beneficiaries, which is a good thing. Extend Social Security Trust Fund solvency from 2034 to 2096. That's a very good thing. And it has strong public support, but now it is languishing in Congress. And so some people are hoping that Congress will pass this bill and have the president sign it before Biden leaves office. And there are fears that when Trump takes over, that they may not be interested in passing this legislation to give more money to Social Security beneficiaries. I'm just reporting the news, so you make your own mind about what you think is going to happen. Do you think Trump is going to boost Social Security benefits? If you think so, let me know in the comment section. If you don't think so, I want to hear from you. And if you like the video so far, please hit the like button, hit the subscribe button. I have more things to share with you. So the next thing I want to talk about is the 10 big changes that are coming to Social Security. That is going to affect everybody. The first one is how much money you're going to get starting in January. If you're on Social Security retirement benefits, your average benefit is going to go up from $1,927 to $1,976. That is a $49 increase in Social Security benefits on average. Some of you may get less. If you are a couple on Social Security, your benefits are going to go up by $75 to $3,089. If you're on SSDI, you're going to see an average increase of $38 to $1,580. If you're on SSI, your maximum benefit will go up by $24 to $967. And if you're a couple on SSI, your maximum benefit will go up to $1,450, an increase of $35. The next change that is coming in January is, Social Security, if you retire and you collect benefits at your full retirement age, you get the maximum benefit you're entitled to. Each year, that maximum benefits at full retirement goes up based on COLA, or changes based on COLA, the cost of living adjustment. So in 2025, that goes up to $4,018 from $3,822. It means that if you retire your full retirement age in 2025, you're going to get the maximum benefit of $48,216 per year. That is the top at your full retirement age. Of course, if you wait till age 70, you get more money. Next, Social Security is funded through payroll taxes, and each year there's an adjustment of the taxable earnings limit based on cost of living adjustment. So that is going up to $176,100. It means that if you make up to $176,100, you are going to pay Social Security taxes on your income. If you are on disability benefits, you already knew about substantial gainful activity. It is the measure that the Social Security Administration uses to determine if you are disabled and can really work or not. And so there's a limit at which that determination is made. If you are blind, it's $2,590 this year, and it will go up to $2,700. If you are non-blind, it's $1,550. It will go up to $1,620 next year. If you're on the trial work period, that limit is even lower. It's $1,110, and next year is going to go to $1,160. If you go above that limit for a period of time, they may determine that you're no longer disabled because you can work. And then your Medicare Part B premiums are going up to $185 a month. It's going to be deducted from your paycheck. The maximum allowable out-of-pocket cap for Medicare Advantage plans will increase to $9,350. The standard deductible for Part D Medicare will go to $590. However, the Part D donut hole will no longer exist, and then the Part D out-of-pocket costs will be capped at $2,000 for drugs that are covered. The next change is those of you who retired before your full retirement age and are still working, there is something called the earnings test, above which your earnings, your Social Security benefits will be reduced. That number changes every year based on COLA. In 2025, it's going to go to $1,950 a month, up from $1,860. It means that if you are working, you haven't reached your full retirement age, you're getting your Social Security benefits. If you make more than $23,400 next year, for every $2 you go above that limit, you're going to lose $1 in benefit. However, if next year is your full retirement age year, then that limit is $62,160. It means you can make $5,180 a month in addition to your Social Security benefits and not lose a dime. But if you go above that limit by $3, you lose $1. So for every $3 you go above it, you lose $1. And then when you get to your full retirement age year, you can work as much as you want, and your Social Security benefits will not be reduced as a result of you working. The next change that is coming next year is how much credit you need to earn to get one Social Security credit. You know that Social Security, the minimum requirement is you need to earn 40 credits. You can earn that over 10 years, 1 credit per quarter. But you also have to make a certain amount of money each quarter to get 1 credit. That amount is $1,810 in 2025, up from $1,730 in 2024. Next, your Social Security tax rate remains the same at 7.65% for Social Security and Medicare taxes. If you're self-employed, you have to pay both of them. And as I told you, you can make up to $176,100 and have to pay Social Security taxes. The 9th change that is happening next year is that your full retirement age is going up. If your full retirement age for those born in 1959 is 66 years and 10 months for 2025. And then in 2026, the full retirement age goes to 67 years. It's been creeping up slowly and has finally gotten to where after you were born, if you're born in 1960 or later, and you retire in 2026, your full retirement age will be 67. Lastly, there's going to be taxes on Social Security in a way that is done differently. Social Security benefits are currently partially taxed based on combined income thresholds. Starting in 2025, taxation will shift to mirror private pension income treatment. Private pension model means benefits could be fully taxable unless after-tax contributions were made. Implementation includes gradual phase-out of current lower income threshold. The phase-out period spans 19 years from 2025 to 2024 to minimize sudden impact. So here's what that looks like. Starting in 2026, new higher taxable threshold takes effect. If you're a single filer, your income threshold is $50,000. If you're a joint, $100,000. The benefits of the higher threshold means that fewer people will be paying taxes on their Social Security benefits. Lower and middle income retirees will gain most protection. An extended phase-out period helps current retirees adjust. The long-term implications are that higher income retirees may face increased benefits for Social Security taxes, and the system becomes more aligned with traditional pension system. Essentially, this is to help low and middle class Social Security retirees in terms of how their Social Security benefits are taxed in relation to what it was before. So next, I told you if you stay to the end of this video, I'm going to give you 15 amazing financial assistance programs every low-income senior needs to know about. Let's get started. If you're a senior and are on low income, you need to pay attention to this because these 15 programs are going to help you save a ton of money. The first one is the Dental Life Network. It covers free comprehensive dental care for seniors with disabilities or low income. You have to be 65 plus or those with permanent disability to be eligible, and you must lack current access to dental care. Services include cleanings, fillings, dentures, and emergency dental work. To apply, you have to visit the Dental Life Network at dentallifeline.org. So why does this matter? Well, it helps seniors maintain oral health, which is critical for overall being. And this organization has been around for 50 years, so they know what they're doing, so they're a very good group to reach out to. The second organization is the Pets for the Elderly Foundation. They subsidize pet adoption fees for seniors 60 plus at participating shelters. Income guidelines may apply. Check with your local shelter to see if they participate. Services include pet food assistance and veterinary care in some locations. You can visit their website at petsfortheelderly.org to get more information. And the reason why this matters is that companionship from pets reduces loneliness and improves seniors' overall mental health. The next group is the I Can Connect program. It's a national deaf-blind equipment program. It offers free technology like smartphones, computers, and braille display for seniors with vision or hearing impairment. You must meet low-income guidelines and have documented hearing or vision loss. Services include training on how to use the equipment, so you can apply through your state's I Can Connect program. This is a program that's backed by the federal government through the Federal Communications Commission, FCC. It was piloted for 5 years, and then in 2017, it became a permanent program. So why is this program important? Well, it's because it improves communication and accessibility for isolated seniors. So visit the website at icanconnect.org to get more information. Next is about vision care through the American Optometric Association. Free basic eye exams and discounted glasses for low-income seniors. That's what it covers. No vision insurance and income eligibility below established threshold. So to be eligible, you have to not have vision insurance right now, and your income must be below their threshold. The services they have includes a referral-based program available in most states. So to get more information, go to aoa.org. Why does this matter? Because it prevents vision loss and promotes independence for seniors. Program number 5, Area Agency on Aging Pet Support Program. It covers pet food, veterinary care, and grooming for seniors on fixed income, like senior pets on fixed income. Eligibility is typically tied to local income-based qualifications. Some agencies offer temporary pet fostering if seniors are hospitalized, which is a great program. So contact your area agency on aging to check availability. I showed you the area on agency in Maryland as an example. And this program matters because it ensures seniors can afford to care for their beloved pets without financial strain. The next organization is the National Aging in Place Council. It covers resources for seniors to modify their homes, making them safer and more accessible. Eligibility is open to all seniors, but financial assistance is provided to low-income applicants. It connects seniors with grants or loans for home modification like ramps, grab bars, and widened doorways. You can find local services near you at ageinplace.org. Why does this matter? Because it helps seniors live independently in their own homes, avoiding costly institutional care. Next, we're talking about Family Caregiver Support Network program. It covers assistance for unpaid caregivers of low-income seniors, including family members, caregivers of seniors age 60 plus who need help with daily activities, those who are eligible. Services include respite care, counseling, and training for caregivers, along with financial assistance in some states. So contact your area agency on aging. Why does this matter? Because it reduces the burden on caregivers while ensuring seniors receive quality, compassionate care at home. Next, we talk about Emergency Preparedness for Seniors program. This is through FEMA. It covers free kits and resources to prepare seniors for emergencies like natural disasters. Eligibility includes low-income seniors living in disaster-prone areas with mobility challenges. They provide evacuation planning, emergency supply kits, and home safety evaluations. To learn more, go to ready.gov. Why does this matter? Because it protects seniors during emergencies, addressing their specific mobility and health needs. Next, we talk about Senior Planet by AARP. This covers free or low-cost technology training for seniors, including online safety and digital literacy. Open to all seniors with extra support for those on limited income. Offers workshops on internet use, smartphones, online banking, and social media. You can explore the programs or join a workshop at seniorplanet.org. This is an amazing program. Why does it matter? Because it keeps seniors connected, reducing isolation while improving access to digital resources. The 10th program is the National Foundation for Credit Counseling Senior Services. It covers free or low-cost financial counseling for seniors. Eligibility, it is open to seniors struggling with debt, budgeting, or credit issues. Services, it assists with creating financial plans, consolidating debt, and avoiding scams, which continue to grow in this day and age. To find a local counselor or get help, go to nfcc.org. Why does it matter? Because it empowers seniors to manage their finances confidently and avoid financial exploitation. The next group is the PACE program of all-inclusive care for the elderly. It covers comprehensive health care, including medical services, in-home care, and day health programs. Eligibility, seniors 55 plus who qualify for nursing home level care and live in PACE service area. Services include coordinates all medical needs to keep seniors living at home as long as possible. Contact a local PACE provider through the npaonline.org. Why does this matter? Because it offers a holistic approach to senior health, blending healthcare with social support to daily institutional care. Program number 12 or 15 is the National Senior Center Nutrition Program. It covers nutritious meals served at senior centers or delivered to homebound seniors. Eligibility, you have to be a senior age 60 plus with limited income or mobility challenges. It provides balanced meals with opportunities for social interactions and wellness checks. And you can find an agency near you by visiting your area agency on aging or an elder care locator. Why does this matter? Because it helps combat malnutrition and loneliness by ensuring seniors have access to meals and community. And this program has been going on for 50 years, so it's a very solid program. You should definitely look into it. Number 13, Elderly Pharmaceutical Insurance Coverage Program called EPIC. It covers low-cost prescription drugs assistance for seniors. It's income-based. To be eligible, available to seniors 65 plus in certain states. I've shown you the New York State version of it. Supplement, they provide supplement medical care, Medicare Part B care, reducing cost of medication not fully covered. So you can apply through state pharmaceutical programs at ncsl.org. Why does this program matter? Because it bridges the gap in medication coverage, ensuring affordability for life-saving prescription drugs for seniors. Number 14, Foster Grandparent Program. It covers opportunities for seniors to mentor and tutor children in schools or community programs. Seniors age 55 plus with low income who enjoy working with youth. Provides a small stipend and training for volunteer work. That's pretty good. To learn more, go to AmeriCorps.gov. And why does this matter? Because it engages seniors in meaningful work, reducing isolation while benefiting local communities. This is a good program if you want to volunteer and earn a little bit of money. Look into the Foster Grandparent Program, which is available in most states. Number 15, the Senior Legal Assistance Program. It covers free or low-cost legal advice for issues like wills, housing disputes, or elder abuse. Open to low-income seniors, often prioritized for urgent legal needs. Includes representation in cases involving Medicare, Medicaid disputes, or financial exploitation. To locate a service, go to Legal Services Corporation or lsc.gov. Why does this matter? Because it protects seniors' legal rights and provides critical advocacy during critical times. I've shown you Maryland version of the Maryland Legal Aid Senior Lawyer Corps and the City of Baltimore, the Senior Legal Services through the Bar Association of Baltimore City and the Baltimore Bar Foundation Incorporated. So there's a local version in your state and in your community. So check it out. So what do you think of these 15 programs? Did you know this exists? If you did, let me know which one you've used already or which one you're planning to use. And if you didn't know they exist, which one has piqued your interest and you're going to follow through and apply. I want you to take action on this because I'm bringing you these programs because I want to help you save money and be able to get access to programs that could help you improve the quality of your well-being. So, this is all I have to share with you today. Until the next video, thank you for watching. Hit that subscribe button, hit that like button. See you in the next video.